Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no copay. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hey everyone, it's May. Oh my goodness, summer is sneaking up on us again. We want to get out to the beach, go out to the lake, go and do fun stuff. So let's keep doing some great work on ourselves and trying to stay healthy. So want to thank my sponsors who brought this episode to us. Of course, Keto Mojo, keto-mojo.com. They're doing great work for allowing us to monitor sugar and ketone levels. And again, they're just doing great things in the community. They're always out helping people, and they're a great company. So please support them. And also Health Code, Get Health, GETHLTH.com. Great vanilla shakes and chocolate shakes. If you go to their website, they have tons of recipes, tons of tips, tons of great information from Ben Bickman about how to be metabolically healthy. So continue to support these great companies, and I thank you for continuing to listening. Hello, and welcome back to the Life's Best Medicine podcast. I'm laughing because this is just crazy stuff. Like, you know how life works, and things change and life changes and all the craziness. So I have one of my favorite doctors on earth and my new partner in crime, Dr. Deanna Price. Welcome to the Life's Best Medicine podcast.
Hey, thank you, Dr. Brian Lenzkes.
Is that crazy? So tell people about you first of all, like, what made you go into medicine and what your motivation was and what you thought was going to happen and what really happened and all that kind of stuff.
Okay, well, that'll be about 5 hours. No, I'm just kidding. Well, really, I think the bottom line is just helping people. I've always liked to help people, and I love the whole concept of the human body. I think it's an amazing thing. And we still just know little bits of it, really. So that's why I went into medicine. And went after residency, worked at one place that I was a sole practitioner that I completely bombed at because, of course, we don't get any business training in medical school or residency. And then moved in to IMA, which was our group. And we also went to residency together, which was totally cool. Then I left there this was in San Diego in 2015, came to Prescott, Arizona, which is right in the middle of Arizona, about 5,000 feet elevation. So it's not that horrible hot desert stuff. And then I got a phone call, I'm guessing 2 or 3 years ago. I can't remember, from my very good friend, Dr. Brian Lenzkes. And he told me about this concept of direct patient care, which I had never heard of course. And he came up here. We spent a couple hours together, and that was awesome, and sort of just, stuck in the back of my head. At that time, I was working. I mean, ever since I've been here, I've been working for a company that I liked. It was a big company. I never worked for a big company. Always 5 physicians, really, or smaller, or myself. And then it was taken over by what's happening in medicine now. So many places that these big corporations are taking over the medical practice, because Medicare, now that they can see what we're doing with these electronic medical records, is now demanding certain things be put in the records. And if it's not put there, then you don't get paid. If it's put there, you get paid. So then corporations started taking over. And of course, they're not quite as uh, dedicated to the patient as they are to the money. So they really kind of started showing their ugly head at the last year. And so that's why I called my good friend, Dr. Brian Lenzkes, and said, what about this direct patient care? And he was just all over it. He loved it. He said, you're going to love it.
Yeah, and you're in your first 2 weeks right now. So just to give you all a flavor of this, Dr. Price and I worked together. Like, how many years did we work together at IMA? You ditched us way like
11 years.
yeah, so around 11 years together. I stayed there 18 years, and Deanna came in from vacation one time and said, "Hey guys, I got you all a little gift." I'm like, "What?" And then she said, "Oh, by the way, I'm giving my notice. I'm moving to Arizona." I'm like, "What?" But it's so amazing because we always got along so well, and we both had this philosophy that we were kind of direct primary care already back then, but doing that inside the system of HMO and PPO medicine, dealing with the insurance company and all the hassles and all the we went through an embezzlement together. We had our office manager take $500,000 or so, and we got to see each other's character through all those stresses and all that. And then I was so happy for you when you got out, because that was one of the more stressful places of my life, that even though it was just five partners, it was a lot of interpersonal conflicts and personalities, and it's the demands of medicine. It brings out the worst in us, I think.
Yeah, it absolutely can sometimes. And within the business that I've been working in since I've been here, which we'll say started out as Yavapai Regional Medical Center, I've been moved around 4 times. And the first time it was crowded as heck. There were 5 doctors, MAs for all the doctors. There was a PA. There was, and then, all the other ancillary staff. And it was okay. I liked it, but it was still busy. Then I moved to a practice where it was a 2 physician practice with 2 providers, 2 MAs, 2 providers. And this was right when COVID hit. So she had 2 little children and had to quit because of the kids couldn't go to school. So she had to homeschool. She had to do telehealth, etc. And so I was all alone. And I got to tell you, that was like the best time. The best practice was just my MA, who happens to be my best friend, myself, and there were 2 front office girls, and the 2 front office girls were amazing. They were just so patient oriented. You don't often get staff that are people oriented. What if that patient was you, or you were that patient? How would you want to be treated? And they don't think that. And when
Yeah.
you get one, you just thank God for because that's what we're all about. That's our business, is making people better. And that starts from when they open the front door to when they leave the front door. Um,
Yeah,
so
customer service, that's one of the things that I've noticed. It's like when you get so busy, like people are like, just go. We don't care. If you're not happy, we don't like it got to that point. Like I would see the front desk workers not being as friendly. Before, everyone knew each other. They would come in and go, how's the kids? But it got so impersonal because everyone got so right. It's like at the airport when you're trying to get on the plane and everyone's freaking out trying to, check your bags. The flight's oversold, and you have this chaos all the time, and that's what it started turning into. Instead of what you and I really liked, is that personal touch that we all know the patients, we know what's going on in their life, we know they're having marital struggles or work stress or whatever it is. And, when you start getting stressed out, it doesn't help you to deal best with people.
No, and that's the way corporate medicine is leading because of Medicare again. They're pushing the providers to see more and more people, so that stresses them out. It doesn't really give the patient enough time to talk about their problem. Sometimes it takes a half hour just to get them to open up and start talking about their problem. So that's why this direct patient care is absolutely fantastic. I have only been doing it for 2 weeks. All of my patients that I had before that came with me love it. And all the new patients that I've never met before absolutely love it. I mean, we get to decorate the way we want to. It's not a sterile waiting room. It looks more like a living room, and we have some soft music playing, and we're serving some decaffeinated coffee, not caffeinated coffee. And it's just everybody loves it. The patients love it, we love it, and I'm just so happy that you actually brought it up to me, because I really never would have known about it. And honestly, Brian, medicine has to change. It's imploding, and it's
Yeah.
not just a small city. I mean, I live theoretically in a small town. You came from a big town, and it's occurring everywhere. So it has to change. It just has to, because and I hope the patients start demanding it, really, because they deserve, if medical care is a right, then they should have the right to have good medical care
Well,
and not just see
yeah.
a doctor.
Well, the problem is this, and this is what I said from day one when they started changing medicine. We saw some huge changes during our lifetime. And so it was saying, okay, everyone gets a free bus pass, but there's only two buses. Good luck, right? No one can get on the bus. So the problem is, and I know talking to you about the problem in our part of Arizona is there's not enough doctors and there's too many patients. And so people are waiting. And you were telling me how long people were waiting to get in to be seen. I thought, you've got to be kidding. Like, what is it typical? Like if someone wants to be seen, if they have a cough or a sore throat, or they want a physical, how long would they have to book that out, you think, in your old system?
Golly, physicals, I would 6, 9 months, really.
Yeah, for
Six,
sure, right?
9 months,
At
yeah.
IMA where we were, I would tell people book your physical today for next year. Like
And that's what
just
I
do it
would do.
now.
That's what
Yeah.
I would do. And I don't know how the other doctors do it. We don't just sit down and talk about how each other practices. So, but that's what I would do, is I would just say, put your name there, get your spot. If you need to move it, maybe we can move things around, but just put your name there. But that's not just primary providers. I mean, specialists, getting into specialists, it's ridiculous. So really, practicing as a primary provider up here, you kind of have to have a lot of skills. You start picking up, like I've been doing a lot more things up here than I ever did when I was at IMA or in
Yeah, and
San Diego.
that's one thing that I've noticed changes a lot. Like, cardiologists that we both know that we worked with forever. I'll say, like, please, I gotta get. He goes, Brian, I have nowhere to put him. Nowhere. I'm like
Right,
booked out for 3 months. I don't know what to
right,
tell you. And it's hard because we have that relationship and we can't really pull strings to get people in. So we have to learn a lot of those skills. Okay, how do I manage this problem? And
right.
so it's a problem. And I think I told you when we were meeting and talking about maybe working together was one of my neighbors said she went to the ER and she was having she had a urinary infection and then she had something else going on and then she hurt her knee and they go, which one do you want to deal with today? You're gonna have to come back. You can't deal with all of them. It's like you don't take your car and that's not running and say, well, we'll fix the alternator today and we'll fix the engine next week. And then, well,
Right,
I can't drive my car. And so it's stuff like that. We think, gosh, how do you not have time to say, let's fix all your problems while you're here? And that's
right,
one of the benefits of direct primary care is that we have time to really look at all the problems and see if we can't get your car running better so you don't have to see us every week with another problem with your car.
right. And actually, along the same line, Medicare and their annual wellness visits, the rule and Medicare's rule is that we're not supposed to ask the patient any medical problems. We're not supposed to examine them. We're just supposed to kind of
No,
check on their screening and maybe do some labs or whatever. I mean, it's absolutely ridiculous. The patients think it's ridiculous. And so I used to do kind of a partial exam, and I'd always talk to them about their problems. And they would say you'd have to have an extra charge and all that. But what's so beautiful about direct patient care is you could do 5 physicals a year if you want. I mean, if a patient just was so freaked out, they just wanted to get 5 physicals a year, you could do it because
well,
it's covered.
yeah, and that's the problem is that with the system got so, and I was sitting there banging my head thinking, am I crazy here? Like, remember what the HMO we used to work with was you have to check off certain boxes. And if you don't check it
Right,
off, you have to talk about, do you have a gun at your house? Have you thought
right.
about shooting someone? Have you fallen down this year? But nothing about your health problems. It was no physical exam. They go, no, well, you guys are wasting our resources by like, that's how we find stuff. We listen to the heart and see if there's a leak somewhere, right? And so it got so ridiculous that we're asking all this crazy extraneous stuff just to fulfill the government or the insurance model and not really uh taking care of the patient anymore.
Exactly. And they don't like it. They're getting more and more angry about it. So, it's like I said, I just think medicine is going to implode, and it has to change. It has to change because you cannot properly take care of an individual in 15 minutes twice a year or once a year or whatever. If they, and on top of all that, they predicted 50 years ago that there was going to be a physician shortage. And there is. It came to be. There are less people going into medical school now than there were 50 years ago. And so up here in Prescott, half the providers are actually nurse practitioners and physician's assistants, and they have what 2.5 to 3 years of training, and then the other half are going to be either family practitioners, internal medicine, like we are, and doctor of osteopathy or DOs, and that's it. 50%. I think that's huge.
Yeah, it's
And
incredible. It's incredible. And not only that, not only there's less people going in, more people are burning out of the system because the
right,
system that we were both in, it just burns you out. You and I were there late doing charts every night and getting new electronic records and all those things, and you have no life at some point, and the doctors are suffering as a result. We saw a lot of our, older colleagues burning out, not enjoying life, like just going through just rushing through as many, we had it was an endocrinologist. He would pride himself on seeing 60 patients a day. And you go, how do you provide? You can't possibly review labs and take care of people and know anything about them seeing 60 people a day.
right,
It
right.
became such a mill.
Right. And that's what's so nice about direct patient care is you just have, and I mean, since it is your own business, you could schedule it however you want. But we also pride ourselves in being able to see people same day or next day. That's important to them too. I mean, I had a patient come in and say, "Can I schedule an appointment? I got this thing on my hand." And I didn't have anybody at the moment. There was nobody scheduled. I said, just come on in. So we checked him in. And, if I would have done that at the corporate medicine place, they would have flipped out, like, oh, hey, you can't do that. We just want to provide people good service. We want them to walk out feeling like they had some success with explaining their problem and moving on with trying to fix the problem, and make them happy to come back. And I do like to engage in a relationship with my patients too. I like to laugh at them. I like to tell jokes. I like to hear about their latest vacations, stuff like that. And then all of a sudden you become friends. I mean, I can't tell you how many people that were not able to come. Just to let the folks know, for me anyway. I charge $125 a month for people 65 and older, and $100 a month for 64 and less. And so there were some people that couldn't afford it, and I totally get it. And we tried to work with them as best we can. We'll probably do like a physical once a year on them and just do a fee for service. But I mean, they were crying, they were just crying because they couldn't come with us because they liked the way that we practiced medicine and cared for them as people.
Yeah, and I know that like I said, we it was like we were practicing direct primary care in a controlled setting before, and it was so hard. It wasn't that it was just not a good fit because you can't talk about vacations, all this stuff, and have 12 minutes with a patient and stay on track and do. And so it was so hard because we had to sacrifice some of those things. And you and I didn't do that, but that results in us working through lunch and working. Like we had someone who was really complicated. We'll put them at lunchtime and work all lunchtime to like try to get them squared away and get the referrals and all these kind of things done, or work late at night. And so it's hard when you're overwhelmed with that many patients coming down to a smaller number that's manageable, where now we can provide good care and get to know what's going on with the patient.
Yeah, and you feel a lot better. And when you feel a lot better, you treat the patient a lot better. It's really hard as a provider, you're kind of expected to every day walk in the room with a smile on your face and chipper and da da da. And sometimes if you have bad days, it's hard to do that, but you still have to put that darn smile on. But doing direct patient care really allows you to do it naturally, because I don't know, I'm having fun. I mean, my schedule's light because it's only my second week, but it doesn't matter. The busier, the better, honestly, that it gets. But we're just gonna help people and with
Yeah.
their problems.
And it's
Yeah.
fun to be able to put your style without someone with a corporate saying you can't talk about this, you can't, I've had patients ask me, "Can you pray with me? I'm really stressed about something." Sure. Like if you're in a corporate job, they're gonna say, "No, you can't do that. You can't." But the
Right.
patient's asking me, I want to help them and I give them every tool that I have available, right? And so, talking about, and the other thing that's been really important for you, and I think this is key, is talking about nutrition. Like I remember at our old office, you were doing some cooking classes to show people, here's how you can cook at home. Here's how you can get away from the processed food, which we both agree on.
Yes. Yeah, and I am going to start cooking classes here. I know you've been to this office once or twice, but the hallway is huge, so we can just put some chairs in there, and I've already got all the supplies. But yeah, people like that. When I stopped doing the cooking, because I did 3 cooking classes several years ago, but it was just so cumbersome hauling all the stuff there and then hauling it back. If I could just bring it here and leave it here, it's a lot easier. So I definitely want to start that because people really missed it when I stopped. And people need to not just get a recipe book or read a book on on a way to live healthy. When they see it and they feel it and they taste it and they watch how you do it and they see how simple it is, because in their minds they think, eating whole foods, whatever kind of foods, but just whole foods, not processed foods. They just think, oh, that's just too much work. I can't do it. But it really isn't. I mean, you can make it as easy or as difficult as you want, or you can prepare ahead of time, and we can talk about that. And, we can talk about how disease or food relates to disease, relates to health, because we were never taught that in medical school or residency, right? Would
Yeah.
never, never. And it's such a shame, but I am grateful that now the medical community is at least recommending a plant heavy diet. But I really wish, I mean, you walk into a Walmart or something like that, and it's just nothing but processed foods full of sugar. And it's really too bad.
Yeah, and I think that's what's going to be fun as working together. I'm more on the low carb keto side, you're more on the plant based, and I think it's going to be fun how we can merge and we can take
Oh,
care of all
absolutely.
different people based on what their desires are. But I think we all agree, look, let's cut out the processed food, let's cut out the junk, let's watch the stress, let's get our sleep right. And so it's amazing what we can. I'm so excited about. I'm really excited about getting out there because what I've been doing here in San Diego at my direct primary care is we'll meet and twice a month, 3 times a month, depending on the weather. Hey, let's all go for a walk. Let's go for a walk and we'll just talk about life and what's going on. And man, that's 1 hour for us. If we have 15 or 20 patients going with us, we all talk about, and people build relationships and they get in a healthier lifestyle. And that makes our job easier because the patients are healthier because they have relationships now and they're taking care of themselves and doing stuff they enjoy. And they could pick our brain for an hour or two when we go on, and look at them. We get to enjoy the sunrise or sunset and get some exercise in at the same time.
Yeah, absolutely. And this office is in a very beautiful area, and there's a really nice little residential area, and you can see Granite Mountain from there, which is beautiful. So yeah, this is perfect for something like that.
Yeah, and you were and this is the other thing why I really wanted to do this podcast is we parted ways that long ago and we always liked each other, and I'm like, there's no way. I was telling my wife, there's no way that, like, who knows, you never know, maybe we could work together. But when you said I'm thinking about leaving it, I'm like, you got to be kidding me, right? Because I was like, I don't want to just join someone I don't know, and you don't know if it's compatible or if they're taking advantage. Like having someone that you trust and that I trust you with my patients and you could trust me with your patients when we're both, if one of us is gone or on vacation or something like that. It's nice that we can provide that level of care. And, you know, I hear stuff about other doctors that I really just don't want to I don't want to deal with interpersonal conflict.
Right. Not between us, though.
Yeah, we never had it. I mean, we saw a lot, and just being in that environment, it's hard, but it does. I think at some point it can take a toll. We saw some people that take a toll, and just like you kind of lose your compassion and your, caring. It's like you just want to, like, someone calls people. I had some other doctors that, my patient would call at 2 in the morning with chest pain or something, and they would yell at him instead of saying, "Hey, let me help you. You're stressed out, obviously. Like, what can I do?" And trying to get people on track, and just at least being there, being a friendly voice in the middle of the night, maybe.
Yeah.
Hopefully
Well,
not too often, but
right, exactly. Well, I think this is a God thing that we got together and you went direct patient care, and that was interested me. And so then we went direct patient care. Jennifer, who's my medical assistant, my best friend, and we actually own this company we together. I mean, I wanted her to be involved because she knows the business aspect. I know nothing about business. I still know nothing about business.
yeah, we're doctors. We don't know, but having someone like that, she's so smart and sharp, and she
Yeah,
knows how to do IV. She knows so much stuff that we don't do. And you go, wow,
right,
that's a great team to have where we can all use our skill sets. And, who knows what we do down, vitamin infusions or whatever, you never
right.
know. But we
First
really
set up
did.
for 'em. Yeah,
Yeah, and then we talked about things that we could do, like, I'll show you my alpha stim that helps with calm the nerves and helps with stress and attention deficit. Can we get more people off of medications instead of just throwing meds for everything? And I think
right.
the system, because people are so busy, it's a two-sided problem in that patients come in and they want a drug. They want, like, I have a sore throat, I want, huge dose antibiotics, or the doctor feels like if they don't give a drug, they're not doing anything. So there's expectation on both sides that we have to really focus on education and really helping people understand, there are ways around it without having to throw a drug at everything. And then what's the root cause? Why is it that your blood pressure is high? Why is it that you have neck pain and stomach pain and all these things that we've over the years we've kind of learned so much more than we used to know.
Yep, absolutely.
Thinking it's not just a drug deficiency for every problem in the world. Like when you're going through a divorce and stressed out and you get headaches and back pain and stomach aches, and how all these things are associated with the stress and not sleeping and worrying all the time.
Right. And drugs have a lot of side effects, and sometimes people don't relate the side effect to the drug and they just come in with another problem, so they get another drug, you
And then you
know?
get another drug for the side effect, that the drug that
Right.
you don't even need anymore, and then you got this huge med list that's crazy.
And then
Yeah.
people just walking around like zombies, and it's just not a good life. Getting people off, which I think is kind of funny because we're internists, we're internal medicine, we're trained to prescribe drugs for certain disorders, but yet both you and I would really rather keep people off drugs. But unfortunately, people want a quick fix. That's the other problem, is they just want things to happen quickly. And I'll always mention, always, even though most people don't always take me up on it, lifestyle ways to cure their problem or to make their problem better. But the lifestyle way always takes longer. You know, they'd rather have a drug that would make them feel better, right away. So,
Well,
it's a bit of a challenge, but education is helpful.
Well, I'm laughing because someone that you'll know, I'm not going to say the doctor's name, but there's a doctor that we both worked with that was a malcontent and always like, just not a really friendly person. And it caused, anyways, one of his patients came to me and he has poorly controlled diabetes, all these morbid obesity, all kinds of health problems. And so, I like to get a fasting insulin to look at that and see. It tells me a lot about metabolic health. And the doctors told him, like, why would that's useless? That's totally useless. And well, his A1C was, above 7, and his insulin was like 48. I'm like, oh man, here's your problem. We got to fix this problem. This is all lifestyle and stress and everything. So this subsequently, the guy's lost 36 pounds. He's off his meds. His blood pressure's better. He's feeling great. His joint pains are better. His mood is better. And I say, well, you should go back and tell the doctor, that I'm a total quack, that he knew better because he said he needs either, he told him, here's your options, Ozempic or gastric bypass surgery. That's all we
Right,
can do.
right.
All the rest of the stuff is wasting your time. It's like, really? Like, that's your options? Like, that's
Yeah,
crazy.
that
And
is
so
crazy.
And I said, I'm actually impressed that that guy got a fasting insulin on you because most people won't do that. And he said, well, I like argued with him for an hour to get that on the phone at night, because the guy was like, no, you don't need, because he didn't know what to do with it. He doesn't know what it means. So, these kind of things, that's why it's fun when we understand the, the continuous glucose monitors where we can monitor people better and hopefully be able to make choices and get people with lifestyle off of drugs and medicate and prevent problems down the road. We don't want to wait till you blow up your engine and then have to be the best engine repair person. Let's just change the oil, right?
Right, exactly. Exactly. I mean, that's perfect. Just it's like when the faucet you turn the faucets on and the sink is clogged and the water is flowing over the sink and people are sitting there mopping up all the water that's flowing over the sink. Instead, just turn the the water thing off. And then you solve your problem.
Yeah, yeah, yeah. Don't just keep us, trying to bail out the water all the time. Turn the water off and you'll be a
Right,
better.
right. Think
But
about what's the cause of the problem.
but don't you see that a lot that medicine's changed that way where we have like a stamp like cholesterol is this level, you do this drug. Your blood pressure is this, you do this drug. And it's not saying, well, why is that happening? Like we don't think about why it is. We just go, you just need this drug to prevent the problem down the road. Instead of
Right,
saying, well, is there something else we can intervene on? Are you stressed and not sleeping, or what else can be going on in life that's contributing to these things?
right.
So that's why I'm excited that we get to put our forces together because we haven't practiced together as a direct primary care. So that'll be fun to see, learn from each other from different techniques. And, maybe you convert me to plant-based. Who knows?
No, yeah, I think it's all good. I mean, really, to be perfectly honest, sometimes I have a little bit of meat, sometimes I have a little bit of cheese. It's really not as much as I used to eat, but I'm primarily a whole food plant-based. But just eating clean and eating whole foods and low-fat foods and getting some exercise and getting the correct amount of rest and also engaging in your family in a loving way, engaging in the community. There's so many ways that you can build yourself good health with lifestyle, just with lifestyle. That's no side effect, super cheap, and it works. And we know it works.
Yeah,
And
especially if you're in Prescott. It's just think I would have less gray hairs if I followed you about 7 years ago instead of waiting all this time. Because it's beautiful. I drove through there. I'm like, okay, this is home. Like, and it's amazing that I go, maybe I'll reach out to Deanna while I'm here and just see if she's not busy. Maybe we can connect. And so where you live is unbelievably beautiful in the mountains with trees everywhere and everything. And it's just such a nice area with great people. So I'm excited that we can be in a practice with really a lot of retired people who've a lot of military and
yeah.
police and
Mhm.
salt of the earth people, and they just can't get good health care. It's
Right.
tragic.
And it's getting worse because people are leaving. They're retiring. They're going to other states, primary care providers as well as specialists. So it's really it kind of puts the burden on our shoulders because we're the first ones that they see. So, but I'm like I said, I'm ready to do whatever they need to make them feel better. And I'm ready to pick up the phone too and call and talk to the specialist and said, oh, you can't get them in 3 months. They have this, that, and the other. And can you see them in a week? I'd really like it if you could do that. And I've had a lot of success with that because, unfortunately, a lot of that is coming from the front office or it's coming from the
Yeah,
MAs. And the doctor doesn't even know about it, because
totally.
they're busy doing their thing. And so,
Yeah.
if I, as a physician, called another physician, I would say 100% of the time they're always very compliant with me, and they'll see the patient like within a week or so instead of 3 to 4 months.
Yeah, I agree. And I recently just had that happen. They couldn't get him in. I said, let me call him. I know the guy. Let me yank his chain a little bit. And he goes, Brian, no problem. Tomorrow morning, right? And they were
Yeah,
talking 3 weeks down the road. But yeah,
right.
sometimes just being able to have that personal relationship. Now in Arizona, I won't have that relationship yet. So I'll have to bug you to help me pull
Yeah,
strings
well,
sometimes.
maybe sometime we'll just kind of walk around. We'll go to a couple offices. I'll introduce you to some of the really good guys, and yeah, that'll be fun.
Yeah, and I think that's it. I mean, doctors are so busy, they don't have time to pick up the phone and reach out. I mean, how often does a doctor call you and say, I'm concerned about this person, or,
Right,
here's what we're doing. And, I've been fortunate to have great specialists who would call me from the operating room and say, here's what we found, here's what we're doing, here's the plan. Other people, you never hear anything, you don't even get a note from them, and you have no idea what's going on. And that's part of the problem with the big system. And the other thing is in direct primary care, there's a lot of concerns. People think, well, if you're my doctor and I need a CAT scan, it's like we can order it. If you unless you have an HMO and you have a primary that can only order it.
right,
I haven't had any issues. I get MRIs and CAT scans and order labs, and they're all covered. And some
right,
people, it's cheaper to go through a cash pay lab anyways and get them cheaper than their copay on their regular labs. So
right.
it's wild. It's wild when you start realizing how can we make the system more efficient and more patient friendly where if you need an MRI, I can get you an MRI today, right? Instead of having to wait for
Exactly.
insurance. You have to do this. You need 6 weeks of physical therapy. Then you got to go over here. It's like, you know what? Just pay $300 and get an MRI and be done with it,
Right.
rather than
Yep,
suffering for a year waiting to get stuff covered.
exactly. I'm
So what
with
was
you.
your biggest concern? What was the stressor? Like, was it stressful for you going, okay, I'm gonna do this on my own? Or did you feel pretty confident doing it?
No, I felt very confident. I mean, I was ready because I was at the place I was before. I was going to either retire because it was just getting to where, and
It's not
I'm a
fun when it's not fun anymore. You don't
yeah,
enjoy
I
it.
mean, I think I'm a pretty tolerant person. I can take a lot and just sort of blow it off, and whatever. If they want me to do that, I'll do that. Fine, I can play team like. But it was just getting ridiculous. So I was going to either retire or do this direct patient care because I feel like I have more work left in me. I mean, I feel it. I feel like I want to help people. I don't want to just sit at home or play pickleball all day long or something like that. So honestly, when I gave my 3-month resignation, that's when I felt the best. I mean, I just felt like the black cloud lifted from my over my head. And Jennifer, my MA best friend and partner, is I had so much confidence in her. I
Mhm.
wasn't worried about getting the business set up because I mean, like day one, she started already with a budget and a timeline and this and that. So, she knew how many patients we needed to have just to be able to pay the bills and da 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 da. So, that just, I had full confidence in her. All I had to do was be the doctor. So
Oh
that's
my
easy
gosh.
because I just love being the doctor. And so
I
honestly,
love
I
it.
never had any worries or concerns. And I'm
Yeah, when
sure,
you have someone like that, like my office manager, when we first started this, she goes, "How many patients are you gonna see?" I don't know. I don't know. I didn't know anything. I'm just like, okay, I'm just doing this. I have enough patients that I think that I can survive, but we'll figure it out. It's kind of, and she's very type A and very meticulous. I'm like, we'll just see what happens. It should work. I don't, if we, and it, I gave my resignation in January of 20. And then we had this thing called COVID that intervened, and all of a sudden I thought, oh, I just gave my notice 6 months into COVID. I'd start my own practice, right? But it turned out to be a huge blessing because,
yeah,
so many people don't want to go sit in a waiting room with 300 other people sitting there.
right.
It's like, hey, it's just me and you. There's no one else here. Come on in. We'll see you. We'll get you squared away. And so that's the other nice thing about direct primary care. We don't really have to, you have a nice setup there. Deanna did all the work, by the way. I've been traveling and I've been in San Diego, so I get to go home and say, "Oh my gosh, I love it. You decorated everything. It's great." But I think when you start realizing, I mean, I think when there's a need and you fulfill that need and it's really customer service because the great thing about direct primary care, if people don't like you and you don't provide the service, they say, "Okay, I'm out." They could leave. They can go somewhere else. But I
Right.
think it's hard to leave because once you have this level of care, it's like, okay, it's like going from first class flying and then you have to sit and coach. Like, wait a minute, I don't like this anymore. It's like way more, it's a lot different. So, not that I've been in first class very often, but it's just the point of, when
Right.
you have that kind of care, when you have a doctor who cares about you, then you go somewhere and they don't even know who you are anymore and they don't know your name. They just go sit in the corner. You see a different person every time you go in.
Right. Yep, absolutely. I've had so many new patients, people that I've never met before, at the end of our visit are just, thank you so much. I love this practice. I know we're really going to like it here, and I know you have our health in mind, and you're going to do a good job. And that just feels real good.
Yeah, it's exciting, and plus the other thing I think we cheat the system in a way because people who are going to do direct primary care, they care about their health and they want to have a good care, and they care about the care, and they understand the cost of doing care. And so we select for people who are not just saying, I'm just gonna just give me all the drugs and just, don't talk to me about lifestyle and all those things. They're selecting because that's what they want. Otherwise, they just go to the HMO down the street and wait an hour and 2 hours or whatever, and get an impersonal service and get pushed out. But it's nice. I think about it the same way as like if you go to a family-owned restaurant, you know, and like, oh my gosh, how are you? How are the kids? It's so good to see you. And like you feel loved when you walk in there. It's worth it than to go somewhere where it's just like a chain where they go, okay, hurry up. There's people waiting. Get out of here. You spend enough time, where there's no, so going in somewhere like that's one thing I noticed at my gym here in San Diego. Hopefully I'll find one there in Arizona, but they know my name when I walk in the morning. Hey, Brian, good to see you. How are you doing? How's things? And it's nice. Like it's personal. When someone says your name, it's nice when the front staff knows you, you
Yes,
know, and they know about your kids in college or whatever it is. It's just such a nice thing to be able to do. But when you're seeing thousands of patients, you just don't have that option.
that's very true.
What other innovations do you want to do?
Well, other than the cooking classes, you know, we have three exam rooms, and really Jennifer has been just putting me in one room, which is fine. And then if you would come in and work a couple of days a week, and then we have this other exam room that I kind of want to do something that has to do with relaxation, whether that be, massage or not really physical therapy, but, maybe some stretching or, I don't know what,
Yeah.
something. In fact, I mentioned that to a patient today and she's going, oh my gosh, you've got to do that. I love that.
I'm all in. I want to find that, and yeah, we'll get someone who does massage and other things that just for a lot of people just go sit in there, whether it's red light therapy and relax for 15 minutes, whatever it is.
Yeah.
There's so much stuff we can do because again, that makes our life better, makes our patients happier and better, and when there's things that are evidence based that help people, that you go, okay, it's worthwhile doing, and so many things. Just taking a breath, and there's so much beautiful land out there. You just see it, like going for a little hike and mountain bike ride, and it's just so amazing. So I'm really excited. And I'm just a little renter. I get to join you and kind of do our own thing together, so that'll be fun.
Yeah, it's
that's
going to be great, Brian. I'm
that's
looking.
kind of what we did. That's kind of what we did before anyways.
Mhm.
And
Absolutely.
then are you going to be doing Zoom meetings too with people, like if they don't want to come in or if they're a little bit farther out?
Um, yeah, I mean, I have done it. We don't, if like, I'll have somebody, well, for the annual wellness visit, which was kind of different, that had a cold or something and they just didn't want to come in and infect everybody. So we just did it over the phone or, excuse me, over via telehealth. But now actually, since I can, I certainly don't call it an annual wellness visit. It's really an annual or it's a physical, but I do a complete physical. I mean, even though
Yeah.
they've been, some people say that they're not as helpful in asymptomatic patients. People like that. They want you to check their scalp and make sure there's no funky things there, and their ears and their, of course, their heart and lungs I always listen to, but their belly, and they want you to, they just want to make sure they feel like their whole body is doing well, and they
Yeah.
can another year. So
Yeah, and we just spent all that money on stethoscopes and all that stuff. Doctors don't use them. I should just ask doctors, can I just have your stethoscope because you don't use it anymore?
yeah, exactly. I
It's
know that.
amazing, right? It's amazing. It's amazing. It really is. And the importance of the even physical touch is touching someone and putting your hand on their shoulder while you're listening to their lungs, those kind of things. That makes a connection, energy, all those kind of things and knowing you care. But it's no one wants to be rushed through like sheep.
Mhm.
No one wants to be in that kind of environment. And I think that's one thing. That's why I was so excited because I know your personality and I know your compassion and caring about patients and wanting to do the right thing. And being around that is actually helpful for us too, to be around positivity and saying, I love what I'm doing and not being overwhelmed and stressed and run down because I think we've experienced that. And I think that was and I think I can't remember, Deanna, if you remember that I had mold allergies in the building and were
Yes.
you there during that whole thing? Yeah.
Oh, I wasn't, but you told me about it and it sounds horrible.
It was horrific. It was the one of the worst times ever. My eye would swell shut, my lips were huge, and it was because I had a mold allergy and there was mold in my office. So being away from that, I'm a lot happier too. But there were a lot of other reasons. I just realized I wasn't a good fit. anymore. And they probably realized I wasn't a good fit anymore because I wanted to go home and see my wife. I didn't want to be there till 8 at night every night and sit in traffic in the morning for an hour and a half. And, you know, all those kind of hassles that come along with it. And, and also that just it was the interpersonal, you know how it is. You have these meetings and then you make these rules and then no one follows the rules. Then they have another meeting to make more rules, but you didn't enforce the other rules. So I'd go to these meetings, I would leave, and the staff could tell I was just annoyed by the whole thing because it was just a waste of time, really, because you don't accomplish anything. And then after I resigned, one of the medical assistants looked at me and says, "You're checked out, aren't you?" And I said, "Why do you say that?" She goes, "You don't get upset about anything at all." And I'm like, "No, because it's not my problem next year. This isn't my problem anymore. You guys can figure it out." But it's kind of nice when you when it's our thing, when we can have, you can have the pictures you want, it's so beautiful behind you. Everyone should look at that. Um, and have it so it's home. It's homey and nice and not clinical and sterile where you just feel like you're, not in a homey place.
Right. I agree. It's going to be awesome, Brian.
Yeah,
I'm
I'm
looking
excited.
forward to it.
So tell people details of what you're doing and I'll throw in like how do they track you down if they want to track you down?
Well,
They want to join you?
yeah, I'm providing primary care for the cost that I mentioned. We are also, we have a couple of people that are just rock steady healthy that literally I see them once a year, and we're just going to do a fee for service on them for once a year. And if things pick up, then we'll start, and they'll agree to it, I'm sure. I actually did recently an urgent care. So, I mean, we have urgent cares here that tell you to make an appointment. I mean, it doesn't make sense for an
Yeah, you
urgent
can't. It's not urgent. You have to make
care.
an appointment next week for an urgent care. It's like, wait,
Right. So I
yeah,
had a gal come in that said, she's had a long history of pyelonephritis, which is affection of the kidney. And oftentimes she doesn't have any symptoms. And she was kind of starting to have symptoms that sort of reminded her of that. And she just wanted an exam, a urine check, antibiotic if she needed it, blah, blah, blah. And she wasn't part of the program. And she just, we charged her $100, I think, and maybe a couple for the equipment that we used, and that was it. And it was so easy. She worked across the parking lot, so she just came across the parking lot,
yeah,
and
great.
it was really nice to just be able to offer her that service. I mean,
Yeah,
that's
that's
not going to
awesome.
be the bulk of the service, but it's again, we're just here to help people.
Yeah,
And
if you're there and you're available, that's awesome.
yeah, and
So
then the
what?
only other thing that we have is we have a lounge chair that heats up and vibrates. And because in the summer, it's very dry here in Arizona, very dry. It goes down into the single digits is how dry it gets. And we have these little old ladies and little old men that pass out all the time because you just don't realize how much moisture you're losing.
Dehydrated. Yeah.
And so we have this chair mostly, well, for blood draws, but also for IVs. So if people need like a 500 cc, a little bag of, have normal saline or something like that, just to get them hydrated, to get them feeling better, we're offering that as well. We do, I could suture small wounds. I could, we do all kinds of wound care. And just all the regular stuff, hypertension, diabetes, lots of orthopedic issues. I can't think of anybody that doesn't come in with some orthopedic issue. But
Well, pickleball is doing it to
oh my,
everyone, right? They're
oh
getting active and I've been exercising 4 years. Let's play pickleball. Okay,
my.
sounds good.
And they just get so competitive, right? And that's the
Oh
problem.
yeah,
It's
it's
like you
just
have to get to the point when if you don't think you can make the ball, just let it go. Just let it go. Don't run after
no.
it because you'll
Die
kill
for
the
it.
ball.
Go for it. Go for it. We could fix you up. No problem. Yeah.
But
Yeah. So
go ahead.
so what's the name of your company?
So it's Prescott Professional Healthcare,
Okay.
and we're at 3195 Stillwater Drive. It's in a place called the Crossings, just because that's the perpendicular street to Stillwater. It's pretty much all medical here, so it's and what else can I say about it?
Do you have your
Uh,
phone number?
oh yes,
I had to just look at
I
my
don't
card
have it
here and say,
memorized. So yeah, our phone is area code 928-515-2803. And I also give people my cell number for urgent, if they something at night or on the weekend, they're welcome to call me. And that's 619. I kept my San Diego stuff. 619-922-8446. And they could look up our website, which is PrescottProfessionalHealthcare.com. Just all smush it together. There's no dots or dashes or anything else. And that will talk more, a little bit about me, a little bit about Jennifer, a little bit about direct patient care. And then you can click on a link where you can sign up if you want. And yeah, that's pretty much it.
awesome. And I'll be working out of the same office in ArizonaMetabolichealth.com. And all the information, their phone number, because I don't know it off the top of my head. And I don't even know the address. So I'm writing it down as you're telling me. So I'm really excited. I've seen it, and I'll tell you all, this place. I was looking in there because I was like, I want to get a little tiny place, and I couldn't find anything and couldn't find anything. And then Deanna calls me, was like, I found a place. I'm like, really? Where? I thought I was gonna be out in the six. She was in that center. I'm like, you got to be kidding me. I've been looking there. So it's perfect, and it just worked out great. And the people moved out at the right time, and it's just great timing. And it just like very rarely do the stars line up like this. So it's amazing. I mean, I'm blown away. Like you said, it's a God thing, in my opinion
It's
too.
a
It's like,
God thing.
what's the odds of us going from San Diego? We both end up in the same place. We both end up doing direct primary care. Just kind of influence that we both had on each other, and that's what's so amazing. And you were trying to figure out, do I do concierge? How do I do this? What's the best way? And I think you're going to be really happy, and the patients are going to be happy too, because
Well,
they
so
can
far so
afford it.
good. So
Yeah.
far so good.
And be able to get people in and get their EKGs and get their annual exams. And the best thing is for patients, and it happens here all the time, people say, where do I pay my copay? It's like, you don't have one. You
Yeah,
paid it all. It's like all inclusive. You paid for your copay. There's no copay.
right.
Go home. And they're
Nothing.
like, really? I just leave. And they're like, weird. Like it's so nice. It is so nice.
I love it.
So I have to ask you a trick question at the end, since this is life's best medicine. What's life's best medicine for you? Like, what floats your boat? What to get you excited? What gets you going when things are hard? Where do you turn to for inspiration? For Deanna Price, what's life's best medicine?
You know what? I would probably just say, being outside, going on hikes, just being in nature and listening to the birds and, that for me just calms me down. And, especially if I do it alone, I don't mind doing it with other people and chatting, but then that distracts you from all the rest. So either way is fine. But I do like just taking walks on my own. And really that's what Prescott is known for is their hiking. I mean, we have the best trails anywhere. I mean, and we even have trails around the place where I live, and I live in a big kind of facility, a gated facility, and there's just trails all over the place. But
A
I
gated
think it's probably
facility. She lives in like this huge mountain area, golf course, beautiful area. It's like, wow, it's something. But you're right. It's just getting out there. And I agree. I get out there and just in the morning, let my dogs run wild out on a trail where there's no one. There's no one for miles that you can see. And it's amazing. It is just a beautiful country. But no one moved there. It's too crowded. No one from California is allowed to come. I hope no, I'm just kidding. It's just so beautiful, and it's so beautiful and so nice, and the people are great. I mean, it's just really, it was home for me the first time I was there. It's pretty amazing.
yeah, I agree. It was home for me the first time I was here in 2015.
Yeah, I know. I knew it when you said that. I was like, wow, you go, Brian. I came around the turn, I saw this place, and that was it. And I thought, wow. And then when I came there, I'm like, came around the turn, there it is, right? It's just beautiful. So everyone, don't be jealous. It's beautiful. We're up in the mountains. We get a lot of lakes and rivers, and all the breezes going through the palm trees, the pine trees. And it's nice. And so if we have to work, we're gonna do direct primary care and enjoy our time and laugh and have fun and be with nice patients and learn from them. And so I'm really excited about this adventure. I'm set. Thanks for joining me for this. And by the time this comes out, we'll be on Wednesday. On Thursday, I'll be there. So you're gonna show me the ropes. I'm looking to see the new digs there and everything.
Absolutely.
All
All
right,
right.
Deanna. Awesome. I'm so excited.
Thanks
Thanks
for
for joining
inviting
me.
me.
All right. Thanks for coming.
You bet.
Bye-bye.
Take care.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information. And hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.